Millennium Development Goals 4 and 5 are our main concern as a ministry, and particularly reproductive health. And we are saying that, as I said in my introduction, we are supposed to reduce these ratios and improve maternal health and be able to reduce child mortality. And this we will be able to do when we reduce these ratios only when we have skilled birth attendants at every delivery. That is when we will be able to. Why are we saying we are interested in reducing maternal mortality? We are saying that every time a mother dies, every time a woman dies during childbirth in this developing world, her child will almost always die. Chances that that child will survive are very, very slim. And when a woman dies in the postpartum period or after she has delivered, especially the first 6 months or the first 6 weeks of delivery, her child very often dies. And there's a lot of evidence to this, and therefore this is just a reminder to us that we need to do something to make sure that we save the life of mothers, because they translate to whether the child will survive or not. We look at maternal mortality rate. We can see that is the national, and the 880 is the Kakamega one, and we are only better than Northeastern. Skilled birth attendants, national is 42. We are doing 30. We are aiming at that maternal mortality will go as low as 143 by maybe even through our Vision 2030. Still, it's supposed to go lower than that. That skilled birth attendants will go as far as 90%. I would say that, Mr. Chairman, if there is anything you can help us do to make sure that our facilities, both from the dispensary to the Provincial General Hospital, are able to give all those services, drugs and supplies and equipment. Those three will be able to help us be able to give these 7 signal functions to make sure that our health centers, dispensaries, and hospitals are able to give basic emergency obstetric care. 2, please help us to be able to increase the number of district hospitals that can be able to operate on our people and to give blood transfusion. This will help us be able to improve healthcare in this county. Our challenges, in summary, we are saying is human resource capacity. And when I talk about capacity, I'm talking about capacity in terms of training, capacity in terms of numbers. And here we have sealed off the area of training as far as emergency obstetrics is concerned. But we have a problem in family planning training. Family planning training and training of community midwives is a problem. Inadequate equipment and commodities is another problem. Weak community partners.
We as a county, and we as the policymakers of this county, we have a duty to make sure that all the health facilities, we have good roads that will reach the facilities. That's our duty. So that if there is a problem within the community, with the ambulances we have acquired as a county, I want to believe a step will be taken, we will improve on that. Because if the roads are there, good ambulances are there, then this problem will be minimized. So I want to believe that I, as the chairman of Health Services Committee, I will convince my colleagues in the assembly so that we set aside enough money for all improvement and maybe infrastructure of the health facilities. Personally, when I chaired the budget meeting for the ministry, I convinced my colleagues, and the year 2013-2014, it is the only ministry that acquired a lot of money from the county budget. We were given a total of 2.1 billion. Out of the 2.1 billion, we are almost over 800 million for salaries and other allowances, but the remaining was meant for development and supply of drugs. I'm happy as I stand before you. We are doing well on the side of drugs. The only problem we have is staffing. And you know, it's a challenge to this county. We are pointing our finger at the service board because we advertised, people applied, but nothing is going on. That's where the problem is. I've had time as the chairman of this particular ministry. I've gone around, I've looked at our facilities. We have the drugs, and we don't have the staff. And you know, staff in medicine, you need all the skilled people with the knowledge. Yes. So the problem is staffing. And I want to believe we are going to take a step to ensure that we have employed enough staff so that our people will be taken care of. Lastly, may I talk about the equipment? When we were looking at the budget for 2013-2014, I insisted as a chairman, and we invited the engineer. I didn't want to just look at the papers and approve, but I wanted to get clear information about this equipment and to tell us why we are breakages all over. The engineer assured us that this time is going to be a bit strict. He will take care of those machines, and he will make sure that those machines that cannot be repaired, we have to go in for new ones. Exactly, we set aside money for that. So when you see me pick up a quarrel with my beloved minister, please, I'll need your support because I know we have to look at the equipment, okay? I must be taken to head of the facility, be told this is the X-ray we bought, this is the scanning machine we bought, to make sure that I'm doing the work as I'm supposed to as an oversight man. But this time, let us excuse our beloved minister. She's hardworking. The only problem is that staffing is not there. And it is not her responsibility to employ, okay? Yes. The responsibility of employment lies in the hands of the service board.
Impacts negatively on health service delivery indicators, health indicators. And it is my prayer, even as we walk this walk in health provision in this county, we re-examine ourselves. Look at my inside. Let me look at myself. I'm talking on behalf of the health workers within Kakamega County. We re-examine ourselves. I look at my innermost and ask, when I leave my house to go out to work, to serve the people I serve, in the office where I sit, do I have the right attitude towards my work? Do I serve with commitment? Do I serve with the need to go out there as a team player and not just as a team leader? Am I able to embrace all other aspects of health facilities, health workers, medical equipment, what, so that at the end of the day, we are actually having good health outcomes. We are actually talking about quality health, quality and high standard health service delivery to the citizens in Kakamega County. I am not talking as me, Dr. Makoka. I am talking as now the health workers. I represent the health workers within Kakamega County. Honestly, in earnest plea, can we look at ourselves? Ask yourself the question, as I am walking out of my house, the first step I make at my doorstep, do I have the right attitude, the right state of mind to go and serve, to deliver the highest quality, the highest standards of health service that our citizen is looking for in this county? I want to thank you all for having come, for having participated to this last minute. I want to thank Hivos in absentia for funding this dissemination procedure. I want to thank USAID and the WHO, is it World Bank? World Bank for having come out to do this research. that is informing us today about where we are, what we are supposed to do as managers or health workers to improve the health indicators within Kakamega County. Ohers, I want to ask that even in our day-to-day work, as we are moving out to work within Kakamega County, can we embrace all other stakeholders? Can we work together? Can we team up with commitment and dedication to serve this Kakamega County? Thank you.